Hello again. There is a very real danger in modern Western society of allowing ideology to trump science, and the prognosis when that happens is invariably gloomy. I mentioned before on this channel the idea of Lysenkoism, a thoroughly discredited theory of evolution, much favoured by the Soviet Union in the later years of Stalin's rule. Trofim Lysenko was a Ukrainian biologist who believed that he could increase the yield of crops by applying Marxist principles to farming. He did not accept the existence of genes and thought that characteristics acquired by an animal or plant during its life could then be passed on to descendants, a variation of the discredited idea known as Lamarckism. Some of Lysenko's ideas were in strict keeping with the political theories which ruled in Stalin's Russia, but proved ruinous when applied to agriculture. For instance, as his influence grew, he insisted that farmers plant seeds of the same type far more closely together than was usually the practice. His rationale was that these seeds were of the same class. They would not compete for nutrients or space, but work cooperatively in the way that members of the same social class, such as the proletariat, were assumed to do. It need hardly be said that these applications of social and political theory to the natural world did not end well. After the death of Stalin, Lysenko's crank theories were abandoned in the Soviet Union, but then picked up by Mao Zedong in China, where they resulted in a dreadful famine in the late 1950s. What has all this got to do with the modern world, you ask? One situation in Britain illustrates perfectly what is happening here, especially when viewed in light of new developments in the study of genetics. In January 2021, it was announced in Britain that the Mental Health Act of 1983 was to be changed, partly because of the disproportionate number of black people affected by it. Health and Social Care Secretary Matt Hancock said that the proposed changes outlined in the Reforming the Mental Health Act white paper would give people more autonomy over their care and tackle disparities for all who access services, in particular for people from minority ethnic backgrounds. The reference to people from minority ethnic backgrounds was a coded reference to black people rather than those of Indian or Chinese heritage. People of black Caribbean heritage in the United Kingdom are 9 times as likely to be diagnosed with schizophrenia as white people. Those of black African origin are 6 times as likely to receive such a diagnosis. Britain's Mental Health Act makes provision for people to be detained compulsorily in a psychiatric hospital if they are a danger to themselves or others. This is commonly known as being sectioned, alluding to the relevant section of the Act under which this action is taken. It had long been noticed that black people were more likely to be sectioned than white people. They're 4 times as likely to be sectioned and 10 times more likely to be the subject of a community treatment order, whereby they live outside a hospital but are still subject to compulsory treatment. The same phenomenon has been observed in the United States, of course. The reason for the large number of black people being detained or compelled to receive treatment under the Mental Health Act is usually said to be because of cultural differences. Uh, Caribbeans, for instance, might use more florid and extravagant language to express their feelings and intentions. There is almost certainly something in the idea that doctor and patients are sometimes talking at cross purposes when an assessment under the Mental Health Act is made and the psychiatrist white and the person being assessed black. Cultural differences might very well exacerbate what would otherwise be a minor misunderstanding. This is not the whole picture, though. Schizophrenia is at least partially a genetic disorder, That is to say, a genetic disposition of risk might exist and the disease itself develop under certain circumstances which are related to the environment. There is no one gene which tells scientists if a person will develop schizophrenia. It's not like having blue eyes. There are many weak genetic markers. The situation, though, is that when looked at overall and various ethnicities are tested, people of Black African heritage are far more likely to carry the tendency for schizophrenia than are white Europeans. It's just the way things are. When the British Health Secretary said publicly that he wished to tackle disparities for all who access services, in particular for people from minority ethnic backgrounds, he was hinting broadly that he wanted to see an end to such disparities. Ideally, black people and those of South Asian origin would be detained against their will in psychiatric hospitals at precisely the same rate as white people. This would be a kind of racial balancing. If 5% of a city's population are black, then no more than 5% of them should end up being sectioned, and not the 20% which is currently the case. The consequence of adhering to an ideological desire to reform mental health rather than one driven by science was unfortunate. The ill effects were not as catastrophic as when the Chinese government adopted Lysenkoism in the 1950s. It didn't lead to millions of deaths, but almost without a doubt, some people died needlessly. Once psychiatrists and nurses were made aware that there was a drive to reduce the number of black people being detained under the Mental Health Act, they became reluctant to section any black people. No health authority wished to be thought of as institutionally racist, and word went out to avoid, where humanly possible, increasing the number of black people being held in hospitals or treated compulsorily in the community. Murders committed by those suffering from psychosis, although mercifully rare, increased. Committed, it is often the case, by people with paranoid schizophrenia. If for political and ideological purposes there is a pressure not to detain this person or that because he or she belongs to some group, especially a group with an increased propensity to schizophrenia, then it is a racing certainty that at least one such person, released against the wishes of a psychiatrist, but to fulfill some quota, will go off and kill somebody. I will leave it to viewers to think about the number of cases over the last 4 years when a disturbed black person has begun stabbing people at random, and the way in which it comes to light that this person had been examined by professionals who declined to section him. It has been a recipe for disaster. It is what happens when ideology dictates policy rather than science.